Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. How are you today? Now, before we start our lesson, let's pray together with your own belief. Okay. Now, in this occasion, let's start our lesson, and the topic is we will discuss about the psychosocial and spiritual needs. After this class, I hope you able to understand and explain the concept of psychosocial and spiritual needs. Includes the concept of psychosocial and spiritual, and then about psychosocial and spiritual nursing care, and the last is about psychosocial and spiritual aspect in an Islamic perspective. Now we are going to discuss about self-concept. Do you know about self-concept? What is self-concept? Self-concept is an individual conceptualization of themselves. Self-concept directly affects one's self-esteem, how one feels about oneself. It's a subjective sense of self and a complex mixture of unconscious and conscious thought, attitude, and perception. Nurses need to help clients adjust to alteration in self-concept and support components to promote successful coping. Self-concept is one's mental image of yourself. Your mental image of yourself. It's about appearance, value, belief, and it influences your behavior. There are four dimensions of self-concept. There are self-knowledge, social self, self-expectation, social evaluation, and it's influence me-centered versus other-centered. And it's also make a self-awareness for us. Now we are next to about the formation of self-concept. It's developed as a result of social interaction. There are a theory that study about self-concept. There are erection theory. And its broad step in development of self-concept, like a global self and best self-concept on several areas. Maintaining self-concept on ongoing process, their ideal self and nurse view of self. The next is, this is example behavior associated with the Erikson stage of psychosocial development. This based on the Erikson theory. There are some stage that have developmental tasks. The first is the infancy stage. There are trust versus mistrust. And the behavior that indicate positive resolution is in this stage is requesting assistance and expecting to receive it, and expressing belief of another person, sharing time, opinion, and expression. And about the behavior that indicated negative resolution in this stage is there are restricting conversation to superficialities, refusing to provide a person with personal information, and being unable to accept assistance. In toddlerhood stage, there are autonomy versus shame and doubt. There are of behavior that indicating positive resolution in this stage is accepting the rules of a group, but also expressing disagreement when it's felt, expressing one's own opinion, and easily accepting deferment of a wish fulfillment. And about negative behavior is failing to express needs, not expressing one's own opinion when opposed, and over concern about being clear. And in the early childhood stage, it's called initiative versus guilt. There are positive behaviors, starting project eagerly, expressing curiosity about many things, and demonstrating original thought. And about the negative behavior, that is imagining the author that developing independent ideas and apologizing and being very embarrassed over small mistakes, and then verbalizing fear about starting a new project. And for the early school years stage, there are industry versus inferiority, and positive behavior is completing a task once it has been started, working well with others, using time effectively, and not completing tasks start. And for the negative behaviors, not assisting with the work of others and not organizing work. For the adolescent stage, there are identity versus role confusion. There are positive behaviors asserting independence, planning realistically for future roles, and establishing close interpersonal relationships. For the negative behavior is failing to assume responsibility for directing one's own behavior and accepting the values of others without question, failing to set goals in life. For the early adulthood stage, there are intimacy versus isolation. The positive behavior is establishing a close, intimate relationship with other person, making commitment to that relationship even in time of stress and sacrifice, and accepting sexual behavior as desirable. But in the negative behavior is the individual remaining alone and the individual avoiding close interpersonal relationship. In the middle-aged adult stage, there are generativity versus technician, and the positive behavior is being willing to share with other person, guiding others, establishing a priority of needs, recognizing both self and other. But in negative behavior, the individual will talking about oneself instead of listening to others, uh, and showing concern for oneself instead of the needs of others, and being unable to accept interdependence. And the last is in older adult stage is there was integrity versus despair. This is using past experience to assess other, maintaining productivity in some area and accepting limitation. And the negative behavior that uh, appear is crying and being apathetic, and then not accepting change, demanding unnecessary assistance and attention from the other. Okay. There were four components of self-concept. There are personal identity, body image, and role, performance, and self-esteem. Personal identity is internal sense of self or individuality, wholeness, and consistency of a person over time and different situations. Achievement or acknowledgement of one's identity is necessary for intimate relationship because you express your identity in a relationship. Uh, Personal identities includes a person's name, gender, ethnic identity, family status, occupation, and various roles. And about the body image, the body image is physical appearance and function. A person attitude about their physical image, body appearance, and function. That is a body image. And then about role function, role performance. Role performance is perception of ability to perform life roles like a job, parenting, and one perceives his or her ability to carry out a significant role such as husband, parents, story of woman who can have sex. And the last is self-esteem. Self-esteem is sense of self-worth. Yeah, you feel worth with yourself, and it's emotional appraisal of oneself. Okay, we are going to the role performance behavior. There were reinforcement extinction. Reinforcement extinction is certain behavior used or a fight based on previous result of using them. Certain behavior become common or avoided depending on social norm. And the other role performance behavior is inhibition. Inhibition is refrain from behavior, even if tempted. An individual learn not to do a certain behavior, even when tempted or pointing at people. And then about substitution. Now, substitution is replace one behavior with another. Yeah, replace your one behavior with the another, which provide the same personal gratification. Maybe you avoid cigarette, yeah, with the smoking lollipop. And then about imitation. Imitation is acquired knowledge or skill from others in social or cultural group. Yeah. This remember your children can be a mirror image of you. This is an image in imitation. And the last is about identification. Identification is internalization of one's role, model behavior into personal self. And the person internalized the belief, behavior, and values of that group. Okay, now we are going to self-concept strata. There were some stressors that influence self-concept. There are identity stressor, body image stressor, raw performance stressor such as conflict, ambiguity, strain, overload, or, and the last is self-esteem stress. It's a near real or perceived change that threaten identify body image or role performance. Now they are going to identity stressor. Identity stressor common in adolescents. Why are they up to this? Their body is changed, their image of self and the world is changed. Role performance is changed. Yeah, so it's common in adolescents. And about body image stressors is a change in structure or function. Change in appearance, structure, or function and adjust to physical, emotional, and mental change. And about role performance stressor is normal change associated with life or any major change, such as conflict. Conflict is assume two or more rules that conflict. Ambiguity, unclear expectation in rule, such as, for example, as in adolescence, adolescent is expected to assume adult-like roles. And about the strains is client not suit to role and blend of conflict and ambiguity, frustration set, and you feel unsafe for a role. And the last is of overload is rules become unmanageable, having more than one rule or responsibility. And self-esteem is stressor, such as criticism, negativity, pregnancy, rules, health problem, financial change. It decreased self-esteem contributes to feeling unfulfilled and misunderstood. Okay, we are going to factor that affect self-concept. There are stage of development, family and culture, history of success and failure, results, stressor and illness. Family create and maintain self-concept of its member. Children develop a basic sense of who they are from their family and caregiver. Nurse mass acceptance creates a positive relationship. Nurse acceptance of a patient with an altered self-concept helps to promote positive change. For example, as drug addict in pain, remember not to judge the patient. They all have a right to care and the same care. Okay. Next, we are going to the alteration. The alteration is exhibited in variety ways, maybe temporary, such as lower self-esteem, and then about the eating disorder, this set of maladaptive response to stress, cause low self-esteem, self-hurt, and fear. Okay, the point about eating disorder. The form of eating disorder is such as anorexia nervosa. Maybe I'm sure that you ever hear about this eating disorder, anorexia nervosa, bulimia, syndrome with multiple predisposing factors. Uh, Anorexia nervosa is because of extreme perfectionism in your um, thinking and fear of weight. And about bulimia is cycle being eating followed by purge. And the syndrome with multiple predisposing factors to the disorder can occur in the same person. And the other eating disorder, the kind of eating disorder is being eating disorder. And the other disorder is purging disorder, nocturnal sleep-related eating disorder, and Prader-Willi syndrome. And the other disorder is personality disorder. This is enduring pattern of inner experience behavior. It deviates from expectation of individual culture, pervasive, inflexible, and begin in the adolescent or young adulthood. There are 11 types of personality disorder. Odd and eccentric, dramatic, emotional, anxiety, and fear-based personality disorder. And common clinical feature, there are impaired sense of self, thinking patterns, emotion, behavior. Now we are going to the nursing care with the self-concept. Um, there are five steps that we must do. The first is about the assessment. The assessment, you must assess about the psychosocial assessment of your patient, about how the personality identity and how the body image patient, how the role performance of the patient, how the self-esteem that they have, and then you must assess a patient establish trust, working and relationship, and guidelines for psychosocial assessment. And the other assessment that you must do is how about their personal identity and how they think about their body image. Like you can ask to the patient, what do you like best about your body? What do you like least about your body? And if you could change how you look, what would you change? You must assess too about the role performance. And assessment about the self-esteem, you must assess these two. There, you must assess cultural background that affect the patient behavior. You can ask to the patient question, what do you like best about yourself? What do you like least about yourself? How do you describe yourself to others? How would others describe you? And what are your strengths and weaknesses? And the last is you can do the assessment interview. And now, for how to carrying intervention. The first is you must identify area of strength. You you can with a framework or identifying personality strength and the specific strategy to reinforce strength. And the second is enhance self-esteem. The therapeutic relationship requires self-awareness and communication skill. And then a developmental consideration. And about pharmacologic therapy, it's depend the disorder. For eating disorder, you can collaborate to other um, health staff to give an antidepressant and or drugs trial disappointing for anorexia. And for the personality disorder, you can collaborate to give medication use to target specific symptoms such as decrease their behavior or SSRIs, clonidine, guafacin, and then overall treatment includes therapy such as blue family behavior. For the nursing diagnosis that can we take is disturbed personal identity or ineffective coping or disturbed body image and chronic low self-esteem. The levels that the nurse assign a problem. Okay, this is about the planning. Goals and outcome. The goals and outcome must be realistic and individualized. The goal must be measurable and such as a patient with verbalized feeling by the end of shift. And then about the priorities, you can use Maslow about the physical needs must be met first. Yeah, you must prioritize the physical need. Yeah, for the first. And the continuity of care is who is the client support system when they are released from nurse care. So you want to get the family involved in the patient care now so they know what to do when they get home. And the next is about implementation. Yeah, there were health promotion, acute care, and restorative care. Putting it all together, putting your plan into action, creating an environment to the patient feel comfortable. And if you have talking with the patient, use non-threatening or judging environment. And health promotion help client develop a healthy lifestyle. Support measure for healthy adaptation to change. And about acute care, you can multiple station required plans for follow-up care after acute care is provided. We can apply this back to our drug addict in the ICU provide community resources to help get them off drugs. And for the restorative care, long-term, increase client self-awareness, develop trust, collaborative planning for clients' care, designed to help patient reach a goal, and adapting with support, home health care, and rehabilitation. And the last is about evaluations. Uh, did it work? So requires So this requires critical thinking to put the whole picture together. There are client care and client expectation. The client care is nonverbal sign of increased self-concept and verbal expression of increased self-concept. Can the patient look at the colostomy, maybe asking question regard care of it, looking for signs of increasing self-concept? What are the four self-concept? Identity, body image, role performance, and self-esteem. And about client expectation, a client verbalized satisfaction. Once you have established a good relationship with the patient, you can ask how everything is going and how they are feeling. Maybe that's all about the self-concept. We are going to concept grief and loss. I think uh, I think you are you ever have you ever feel grief and loss in your life. Yeah, loss. There are four forms of loss. There are actual loss, perceived loss, maturation loss, and situational loss. Actual loss is lose a person, object, or function. And the perceived loss is defined by individual client and about rational loss is a cure with life event such as emptiness, yeah, the emptiness. And the last is about situational loss is sudden and unpredictable and external event cause the loss. How about the grief? There are mourning, bereavement, and anticipatory grief. Mourning is emotional response to a loss, outward social expression of loss. And but the bereavement is inner feelings and outward behavior of survivor. Several stage of grief. Yeah, there are five stages of grief based on Kubler-Ross uh, theory. There are denial phase or denial stage, anger, regaining, depression, and acceptance. What is denial? Denial is act if nothing has happened. Uh, you act if nothing has happened. And for the anger is you resist the loss and might strike out the everyone. And for the beginning, they postpone awareness of the reality. God just get me my grandchild's graduation or birth, such as like that. And for the depression stage is the feel of overwhelming, lonely, and withdraw for interaction and living. For the acceptance stage is they accept the loss and look to the future, not at how much is left, but to make it worth every minute and quality versus quantity. So with a stage uh, your grief, denial, anger, regaining, depression, or acceptance. Yeah, this is the responded in each stage. Yeah, you can read uh, later. Yeah, this is the response. Yeah, based on the figure, such and denial, you might avoid confuse, fear, numbness, playing in the first stage, yeah, denial. And then you might grow in the anger stage. You might feel a frustration, anxiety, irritation, embarrassment, and shame. And the next stage is you might going to the depression and detachment stage. You may feel overwhelmed, bias, lack of energy, helplessness, and then you go to the next stage, dialogue and bargaining, reaching out to other. You might decide to tell one story, struggle to find meaning for what has happened, and then you might go to the accepting stage or acceptance phase. You might exploring option and you can create a new plan in place. Yeah, this is a stage of a meaningful life. There are three. Now we go to the going to the types of grief. There are three grief. There are anticipatory grief, complicated grief, and disenfranchised grief. Anticipatory grief is disengagement prior to actual loss. And about the complicated grief is chronic delight in gratitude or mass. And then disenfranchised grief is loss that cannot be acknowledged, such as a spouse or partner with AIDS. Now, how about the nursing care? The first step is you must do the assessment. What's the assessment that you must do? The first is you must assess the type and stage of grief. It's important for the nurse to assess how the patient or family is acting rather than how they should act. When they are dealing with this loss, are they depressed, angry? This will guide you as the nurse how to proceed with the situation. And the second is you must assess the grief reaction. It's outward or they are holding it. And the factor the affecting grief. What do you think they can be relationship, support system, regret, and life of decisions. And life of decisions are very personal, and you have to respect them. And nurse personal person with grief, you have to assess your emotional well-being and keep your personal thoughts or opinions to yourself. And you must assess the patient and family expectation patient and family expectation of you and the role you will play in this process. And then factor influence lose and grief. Loss and grief. There are age, significance of the loss, culture, spiritual belief, gender, socioeconomic status, support system, and cause of loss and death. Toddlers deal with death and loss differently. Because they are too young to understand what is going on, but have anxiety over loss. The death at some point in their life is overwhelming and involves many different emotions. Assess the family and patient to see how you assist in helping the family grieve in a healthy way. Story of needing checks, don't pass judgment. How will this loss affect the family? It's said that to lose your parents is to lose your past. To lose your spouse is to lose your present. And to lose your children is to lose your future. And the ability to resolve grief depends on the meaning of the loss and the situation surrounding the loss, and the ability to ask or accept help. This really affects how you will deal with the family, so be aware of it and incorporate it into your care. Spirituality significantly influences their ability to cope with loss. This is a death ritual by culture. In African American is different with the Chinese, different with Hindu, Jewish, Mexican, Arab, or Japanese. We must concern about it. And the nursing diagnosis that can be create is grieving or complicated grieving, interrupted family process, or risk-prone health behavior and risk for loneliness. And for the planning, the goals, and the goal make it realistic and find out what the family can deal with at the time. You must setting priorities such as eating sufficiently, try to keep the same staff that interact with the family, and impending death such as low blood pressure, low or no urine output, loss of rectus or chain stop, or decreased appetite, or make sure you have plenty of time to spend with the family. They may need you. For the implementation, the important thing that you must do when implement uh, the 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 important point is listen to them. They will want to tell their story, and it's very important that you hear that. You must promoting hope. Hope can provide meaning and purpose. Don't ever underestimate it. You can let them know there is always hope, but this is what you usually see with this situation. Hope can be if the family member donate their loved one's organs. They feel that they live on, the nurse can play in a role in that, and you can call the organ donation organization and help them accept the loss is real, support effort to life without the deceased person or disability, allow time to accept loss, and interpret normal behavior like loss of appetite, provide continuing support of emotion and feeling, and be alert to ineffective coping of alcohol or pain medication. And in the postmortem care, is care of the patient once they have died. Once you know the patient is not a coroner case, you remove all tube, clean the patient, make them appear as normal as you can, dim the light, have plenty of chair and tissue, encourage the patient and family they can touch the patient. Once the family has spent time with the patient, you will beg them to go to the morgue. In the palliative care stage, in palliative care is focused on comfort rather than cure. Palliative care is the prevention, relief, reduction, or soothing of symptoms of disease or disorder with effective cure. It's not a cure, it's just a relief of pain and discomfort. It's for any age with any diagnosis. So palliative care is just a symptom control, not a cure. And this maintaining dignity and self-esteem of the patient, and then you must promote the spiritual comfort. Okay, in the psychological change in the dying patient, here are maybe the a change in the patient. We can feel pain, deep snow, and anorexia, nausea, dehydration, altered level and consciousness, and hypotension. This is the psychological change in the palliative care patient. And for the supportive care, nurse must consider consular influence when providing postmortem care. And in the grieving stage, the nurse multiple loss might create a need for a support system for the nurse. In the evaluation, make sure that make the best it possible can be, and you must evaluate that did you have the patient and family meet their needs? If no, why? If no, why? Yeah. You can ask to yourself. Okay, that's it about the this, and then we are going to spiritual health. Yeah. What is spirituality? Spirituality is multidimensional in that it refers to one's relationship with oneself, a sense of connection with others, and relationship with a higher power, a divine source. Spirituality assists people in determining the sense of meaning or purpose in their lives. It's an integral component or core of one's being. The classic word of Franklin in their book, uh, the name is Man's Search for Meaning, emphasizes that the need for meaning is the primary motivating force in a person. By asking questions such as, what does this mean? And why me? A person seeks to find the meaning. According to the Franco, people find meaningfulness by what they take from world, what they give to the world, and the attitude they can choose for themselves in response to suffering. Spirituality is different with the religions. You can see in the table, this is comparison religion and spirituality, which refer to as spirituality is a set of belief and practice associated with the particular cults, synagogues, mosque, or the former organized group. Spirituality is a personal, individualized set of belief and practice that are not affiliated with the institution or sect. Yes, religion, spirituality. Religion is a subset of spirituality, but spirituality is universal. The religion is denominational, but spirit is ecumenical. Religion is behavioral and spirit is spontaneous. Yeah. There are five components of the spirituality. There are need of spiritual, and then there are spiritual health and well-being, and then spiritual distress, and then core aspect of spirituality, and the last is spiritual development. And about spiritual practice in belief and affecting nursing cares, about food and nutrition, healing, body coverings like this, hijab, and birth or death, and religion and medical care in our country is Islam, Catholic, Protestant, Hindu, and Buddhism. Now, this is differentiation of the word religions and health, what health implication with the belief. In Islam belief, and this is a belief affecting dietary practice in Islam. Pork is prohibited, and any meat product not ritually slaughtered prohibited, and avoidance of alcohol and drugs. And during Ramadan, fasting occurred during diet time. This is what diet. And about the birth is there is no belief, no baptism. And about the death, if the Islam family there were member of the family is dead, family must be with the young person. The young person must be confess sins and ask forgiveness. Family wash body, and only family and friends may touch the body, and usually a post autopsy. And how about the uh, belief affecting haircut in Islam? White healing and acceptable, and ritual washing after prayer, which occur 5 times a day. And in the other religion, such as Buddhism, there are beliefs in dietary such as alcohol and drug use discouraged. Some sects are vegetarian and belief about birth, no infant baptism, infant presentation, belief about the death, chanting of last rite at bedside immediately following death, belief of a health card, see illness as a result of negative karma. View cleanliness as a very important and often hesitant to receive treatment. For the Christian Science religion, there are beliefs about daily practice such as no restriction or requirement for dietary, and in belief in birth is no baptism, and belief about death is no last rites, and organ donation usually opposed, and belief of affected healthcare. They view illness as a mental concept that can be changed by prayer and reject drugs or other therapy. In the Hinduism daily practice, beef and feel prohibited. Many are vegetarian, limited consumption of meat, and fasting occur on the specific day of the week according to the god the person worship. Children are not allowed to participate in fasting. Fasting ritual vary from complete abstinence to consumption of only meal per day. Fasting may occur over 1 month period or be observed only on holidays. Belief about birth, no ritual, and belief about a death. Last rites are carefully prescribed. Priests pour water into mouth of the dead and ties a thread around the wrist to indicate a blessing. Family is particular about who touch the dead body, and cremation preferred. How about the belief affecting health? Illness viewed as a result of sins committed in previous life. In the Roman Catholicism, there are beliefs affecting dietary practice such as option of fasting during Lenten season. During Lent, no meat on Friday, and children and young people exempt for fasting. Belief about birth, infant baptism mandatory, may be performed by anyone if child is gravely ill. About the belief of about death, the mandatory rite for anointing the sick, last rite performed by priest, autopsy acceptable, and organ donation and transplantation acceptable. And about the belief affecting healthcare, life life is viewed as sacred. Abortion and contraceptive use are prohibited by Crohn's doctrine. Okay. We are going to the nursing care, but the spiritual assessment. You must do a clinical assessment, and you do assessment interview and assess religious and spiritual needs. This is the assessment tool that you must assess the patient There are three dimensions: meaning and purpose, inner strength, and interconnectedness. What the question that will uh, give about meaning and purpose? You can ask to the question, what gives your life meaning? Do you have a sense of purpose in your life? Or how helpful are you about getting better? And for the inner strength dimension, you can ask to the patient, what brings you peace and joy? What do you like about yourself? What are your life goals? And what do you believe in? And about interconnectedness dimension, you can ask to the patient, who are the important people in your life? Do you belong to any groups? Can you ask others for help when you need it? Do you participate in any religious activities, or do you believe in God or a higher power? And for nursing diagnosis that you can create is about spiritual distress, readiness for enhanced spiritual well-being, fear, hopelessness, impaired religiosity, or readiness for enhanced religiosity. And you can do create a planning. You can create a good goals and outcome, setting priorities, continuity of your care. And for the implementation, you can uh, establish presence. You can support a build a supporting healing relationship with patient. You can build a support system for your patient and family. Create a dietherapist supporting ritual, prayer, meditation, meditation, and supporting grief work and pastoral or spiritual counseling. And intervention for clients experiencing spiritual distress related to nursing priorities for assessing contributing factor and assisting people to deal with feeling and the situation and promoting wellness. There are examples of specific intervention that you can do include noting expression of inability to find meaning in life, not expression, and then listening to expression of anger or alienate from God, and determining religious or spiritual orientation and friends of belief, asking how the nurse can be of the most help, providing a quiet setting, and developing a therapeutic relationship that supports free expression of feeling and concern. Assisting client in developing goals for dealing with illness and other distressing situations. Assisting the client in identifying spiritual resource and the other support. In the evaluation stage, and this you must evaluate how the client care, how the client expectation. It identifies the following as indicator that client spiritual distress has lessness. If the patient acceptance of spiritual support from the source with which the client feels most comfortable, and patient decrease in restlessness, insomnia, and crying, and decrease in statement of worthlessness and hopelessness, and verbalize of satisfaction with spiritual belief and the comfort provided by them. That's the evaluation for the nursing care with patient with the spirituality disorder. I think that's all about the psychosocial and spiritual needs. And if you have a question, you can ask to me in the uh, group. Yeah. Okay. I think that's all. Thank you for your attention. See you. Assalamualaikum warahmatullahi wabarakatuh.